Welcome to my week 9 video. In this video, I will be going over how to set up your scan for the hip, the ankle, and the knee. I'm going to go over how to position your patient, what coils you're going to be using, and what landmarks you will be setting at. So let's just go ahead and get started. So first, for every single one of these scans, the first thing you will be doing is demetallizing yourself. So this includes locking up your cell phone, keys, wallet, any potentially ferromagnetic items. You want to make sure that they're locked away and not on your person before you enter the scan room, zone 4. You also want to make sure that your patient is completely screened. If they have implants, you want to make sure that they're verified and safe to go through the scanner. And you also want to make sure that your patient is demetallized as well. You are also going to sanitize the scan room completely. So this includes scanning or sanitizing the table, the coils that you will be using. You want to make sure that you provide fresh bed sheets and linens before the scan. So beginning with the knee, the first thing that you're going to do is get your coil ready. The coil that you're going to use for the knee is a quad channel knee coil. You want to position your patient supine and feet first into the scanner, and your landmark for the knee is going to be the apex of the patella. So starting with your axial scan of the knee, you want to plan this on the coronal plane, and you want to angle parallel to the medial and lateral condyle of the femur. You are also going to cover from the tibial tuberosity to the superior patella. For your coronal scan of the knee, you're going to plan this on the axial plane, and you want to angle parallel to the medial and lateral condyle. You're also going to cover from the anterior patella to the popliteal artery. Now you're going to plan your sagittal scan of the knee on the axial plane as well. You want to angle to the lateral condyle on the femur, and you want to cover completely from the medial to the lateral condyle. Now for the ankle, there are two separate exams, the forefoot and the hindfoot. So the forefoot would include from the metatarsals to the tip of the toes, and the hindfoot would be the heel / the ankle. So these are two separate exams that would require two separate appointments, two separate schedulings. For the ankle, you're going to use a quad channel chimney coil. You're going to position your patient supine and feet first into the scanner, and your landmark will be the medial and lateral malleoli of the ankle. For your axial scan of the ankle, you want to plan this on the coronal plane, and you want to angle parallel to the mortise joint. You also want to cover from the tibio-talar joint to the plantar aspect. For the coronal scan of the ankle, you're going to set this up on the axial plane, and you want to angle perpendicular to the medial and lateral malleoli. You also want to cover completely from the Achilles tendon to the midfoot. Again, for the sagittal scan of the ankle, you're going to set this up on the axial plane, and you want to angle parallel to the malleoli. You're going to cover completely from the medial to the lateral malleoli, including all soft tissues from side to side. Now I'm going to go over the scan of the hips. So your landmark for the hip is going to be the hip joint. If you have your patient lay down supine and bend their knee, it should be where the hips, where it creases. You're going to position your patient supine and feet first into the scanner, and your coil will be an abdomen torso coil, and you want to make sure that the coil covers completely from the top of the pelvis to the bottom of the groin area. For the scan of the hips, you also want to have your patient invert their toes. This is so that when you're running your scan planes, you will have a complete entire view of the hip. So starting with the coronal scan of the hips, you want to plan this on the axial plane, and you want to angle parallel to the femoral heads. You're going to cover the ischial tuberosities to the line of the pubic symphysis. For an axial scan of the hips, you're going to set this up on the coronal plane, and you want to angle parallel to the right and left femoral head. You're going to cover the anterior superior iliac spine to the lesser trochanter. Now it's important to note that for the hips, the axial and coronal planes will include both sides of the hips. So it doesn't matter which side is ordered for the scan, you want to include both sides of the hips so that way the radiologist can compare when diagnosing the patient. Again, this is only for the coronal and axial plane. For the sagittal plane, you're only going to be scanning the affected side. So for your sagittal scan of the hips, you want to plan this on the coronal plane, and you're going to angle parallel to the femoral shaft. You're going to cover completely from the outer cortex of the greater trochanter to the inner acetabulum. So thank you for allowing me to go through the setup for the scan of the knee, the hip, and the ankle. Again, you want to review the doctor's order, make sure that everything is accurate, you have the right patient, you're demedalized, the patient is demedalized, the scan room is sanitized, you have the correct coil, and you're good to go. So again, thank you for allowing me to explain.